What is urinary reflux and how is it diagnosed? Imagine your bladder as a storage tank for urine, designed to hold waste until it's ready to leave your body. Normally, urine flows in one direction, from the kidneys down the ureters into the bladder. But in urinary reflux, also called vesicoureteral reflux, this flow reverses. Instead of moving out, urine leaks backward into the ureters and sometimes even reaches the kidneys. This can happen because the valve that usually prevents backflow isn't working properly, often due to a congenital abnormality present at birth. In children, urinary reflux is most common and often linked to structural issues they are born with. In adults, it's less common but can occur due to conditions like an enlarged prostate or nerve problems affecting bladder control. Usually, urinary reflux doesn't cause noticeable symptoms, but it can lead to repeated urinary tract infections. These infections might cause pain or burning during urination, frequent urges to urinate, lower abdominal discomfort, fever, or foul-smelling urine. In infants, symptoms might be less specific, like irritability, poor feeding, or vomiting. Detecting urinary reflux early is important to prevent kidney damage, scarring, or high blood pressure later on. Doctors often suspect reflux if a child has had multiple urinary tract infections, especially if those infections are accompanied by fever. Sometimes, it's found during tests for other urinary issues or if a sibling has been diagnosed, since it can run in families. The main way to diagnose urinary reflux is through imaging tests that visualize how urine flows. The most common test is a voiding cystourethrogram, or VCUG. During this procedure, a small tube called a catheter is inserted into the bladder to fill it with a contrast dye. X-ray images are then taken before, during, and after urination to see if urine is flowing backward into the ureters or kidneys. Another test is radionuclide cystography, which uses a tiny amount of radioactive material to track urine movement. This method exposes the patient to less radiation, making it a good choice for children who need repeated testing. Ultrasound can be used initially to check for structural abnormalities, but it cannot definitively confirm reflux. Only VCUG or radionuclide cystography can provide a clear diagnosis. It's important to note that urinary reflux is not directly linked to bladder cancer. However, maintaining good bladder health is essential to prevent infections and protect kidney function. In some rare cases, adults with bladder cancer or those who have had bladder surgery may develop secondary reflux because of changes in bladder structure or function. Regular monitoring and proper management are key in these situations. Treatment depends on how severe the reflux is and the patient's age. Mild cases often improve on their own, especially in children, and doctors may recommend watchful waiting with regular imaging. Preventive antibiotics can be prescribed to reduce the risk of infections. In more serious cases, surgery might be needed to correct the abnormal valve or structural defect causing the reflux. Most children with mild reflux outgrow it without long-term problems, but ongoing follow-up with a healthcare provider is vital to ensure the kidneys stay healthy. In summary, urinary reflux is a condition where urine flows backward from the bladder toward the kidneys, increasing the risk of infections and potential kidney damage. It's most often diagnosed with specialized imaging tests like VCUG or radionuclide cystography. While it's not directly related to bladder cancer, keeping the bladder healthy and monitoring for symptoms can help prevent complications. If you or your child experience urinary issues or have a family history of reflux, it's best to consult a healthcare professional for proper diagnosis and personalized care.